Oh, my goodness. And, wow. I don't meet many people who've had 7 kids. Did you have the other ones at home?
Yeah, we've had 2 at home.
Oh, wow. And that's just pretty amazing. And did you like your home births?
Oh, I wouldn't ever do it a different way.
Wow. And did you do the first 5, do the first 5 at hospitals?
My first time was in a military hospital, yeah.
I see. So that's really been a difference. Have you tried the hypnotherapy or considering that?
I've people use it. I've never used it for myself.
Are you thinking of doing it this time?
I might.
I'm sorry for asking you all these questions. This is the risk you take when you call in, you know? Wow. Do you have any other questions about hypnotherapy or birthing? Are you going to use a water birth, you think?
Absolutely.
Wow. Well, this is pretty neat.
Water birth is the best. I would not ever have a baby a different way.
How does it feel different than doing it the other way?
It easily makes the pain of birth half.
Really?
Easily.
Wow. And do you sort of float while you're doing it, or?
Yeah, you just float in the water, and your friends are all around you, and the lights are dim, and the house is quiet, and your baby comes.
Wow. And I guess there's not much difference between the baby like comes out under the water and everything, I suppose. Everybody's shaking their head. I'll ask our professionals here in a minute about that, but baby doesn't seem to mind one way or the other, I suppose. And when the baby was just fine coming out through the water.
Right.
Wow. Well, that's pretty good.
When I had my babies in the water, I just pulled them right up to me, and everything's perfect.
Wow. And have you ever had a cesarean?
I did with my first baby.
Well, that's really amazing, because there's a lot of people, who think, well, you've had a cesarean, that's it, you can never have a vaginal birth again.
No, it's so untrue.
Well, apparently so, times 6. So, well, look, thank you very much for calling in.
Thank you for taking my call.
Oh, pleasure. Hey, bye-bye.
Bye-bye.
Well, I'm having a good night technically so far. I'm amazed I was able to do that. Sometimes I push the buttons and it works, and sometimes it doesn't. So, let's talk a little bit about this water birth thing here, okay? For some reason I keep thinking, oh my gosh, you can get the floor all wet. Describe a water birth for me, please. Stephanie's looking at you, Tammy. You're on.
Well, when a woman has progressed in labor, she the tub will be full. So
it's already full. You've already done that.
All right. So she gets in.
A couple of 100 gallons. Like 100 gallons of water. Is it a big tub?
It is. It's like
big as a jacuzzi type tub.
Diameter probably of your legs are a little bit shorter. The length of your legs.
The length of the depth.
No, the diameter. So going around it.
Oh, right.
So it's not. And it's probably. I think it's about.
So you're sitting. It's not like you're laying back. You're sitting in it.
Yeah, it's really hard to lay back in it because you do float. Honestly, your legs will float up. You can put your arms over the side, but your legs will float up. So what typically women do, a lot of the women that I serve, they end up birthing hands and knees.
Hands on their knees.
They get on their hands and knees.
Oh, on their hands and knees.
Some will squat, and be over the side of the pool.
Right.
So
hey, it's whatever goes. This sounds like it's whatever you're comfortable with.
Whatever position they want to be in. Whatever position's going to work. And
you go by their feeling in this.
Oh, sure. Absolutely. And when they're ready to give birth, it's like any other birth except
we're getting another phone call. Let's see if we can get it on. Hello? Hello?
Hi.
Do you want to get on the radio hotline? Yes, it is. Well, hold on and listen and ask our home birth people the question. Here we go. Let's see if I can get you on the air. If I lose you, call back in. Let's see if I can do it. And can you hear me? Hello?
Hello?
I can hear you. Everybody can hear you. Hi, what's your name?
My name's Alexis Meyer.
Hello, Alexis. Okay. So, Alexis, do you have a question for Stephanie or Tammi? Stephanie is our HypnoBirth and expert, and Tammi is our midwife.
Well, I really don't have a question. I just wanted to add some info that I had a home birth, and I think it was the most amazing experience ever, and I recommend anybody who is thinking about it to do it.
That's awesome, Alexis.
It was amazing.
Was it your first?
Yes, it was my first.
Ah, good for you. All the moms who avoid the hospital from the get-go, good for you.
Alexis,
It was totally the opportunity to be in control of the environment the whole time.
that seems to have a lot to do with it. That must have been a very comforting thing to feel you have control of your body.
Well, and the environment as well, you know.
Wow. Alexis, about how old are you?
I am 30.
And how old is your child?
He is 7 months.
Oh, wow. So this is really new. Wow.
Very new.
And who did you have with you at your birth?
Jenny Rector was my midwife, and her assistant, Renee, was there as well.
Right.
And my husband.
And did he do, was everybody in there to lend a hand? Did you do it in a bucket like these people are describing?
Well, my husband was there in the water.
Wow. Bathing suits?
I'm sorry?
In bathing suits?
Well, no.
You weren't, was he?
You kind of just go when it calls, you know?
Wow. And so I guess you've never even had the experience of doing this in a hospital before. Have you ever been to the hospital for anything?
Well, of course. I mean, we've all been to the hospital for things, and I've seen my nieces and my nephews born. To me, it was just having control of the environment. I wanted a water birth, and it seemed nice to do it at home and not have to transfer to and from, you know?
Wow, I guess also that meant people had to come to you. Wow, well, I'm so happy to hear. Ladies, do you have any questions for her?
I have a question.
No. Oh, okay.
Yeah?
Alexis, did you do any preparation for the birth, any kind of classes or practicing relaxation or anything?
I had the opportunity of going to a couple of home births with Jenny prior, so I had a chance to see what was going to happen and to know what to expect. But her biggest advice was to me just to surrender my body, and to me that's what it was. It was a very quick process, and I really don't remember the pain. I surrendered, and everything went beautifully.
That's wonderful.
I'm sorry, this is much too radical. Women supporting women, surrendering your body and not letting modern medicine take control. Where do you get these ideas?
From these crazy midwives.
I hope you don't get involved in politics. Nobody's going to like you. You're not submissive enough.
It's the power of a woman's body is what it is. We were made to give birth.
Wow.
And then every time you're out and people ask, "Oh, where'd you have your baby?" and you say, "At home." You're that ripple in the pond, letting people know that women still have babies at home.
Well, here's the real question.
This is the way it used to be, right?
Absolutely.
What room did you have the baby in?
I had it in our spare bedroom, which is now his playroom.
So if someone says, "Where'd you have your baby?" you shouldn't say at home. You say, "I had it in the spare bedroom."
In his playroom, you know, with the bassinet and all.
Wow. Well, look, thank you so much for calling. And
You're welcome. I'll talk to you guys soon. Good luck with everything.
Thanks, Alexis.
okay. Bye-bye.
Okay,
Thanks.
bye-bye.
Wow, so we're getting a few calls there. What do you know? This is a big issue for a lot of people. Actually, I got the feeling from the sound of her voice, she just sounded very sturdy. I mean, not sturdy, very. I mean, didn't you feel that I'm bringing my hands and tightening together, but sort of like empowered? She felt very empowered.
Mm-hmm.
Right.
Yep.
I mean, there's just to me, there's so much going on here politically. I mean, no, socially.
Both.
It's a political statement, honestly, to have your baby at home. You're going against the grain of society.
Or a societal statement, but maybe beyond politics.
It has many layers
Yeah.
to it.
The Washington area, this is a tough question since we're on this, but do you think more of your clients are